which is a consumer-driven solution, and here's what I mean. Harvard University says to me, Reggie, you can have your $20,000 back. You can have it back tax-free. And the amount that you use to buy health insurance will continue to be tax-free. You can stay with Harvard University, it's your choice. I would be out of there like a bat out of hell, and I would use that $20,000 to buy very different insurance, and in that process, because I will be joined by tens of thousands of people, we will create a consumer-driven system. To explain to you how much money this is, in 2006, 90% of joint tax filers earned less after taxes than $73,000. So if you say to these people, I'm going to give you back what I'm spending of your salary on health insurance, $17,000, $20,000, somebody who earns $73,000, that's serious money for them. First of all, I'm going to buy very different health insurance from what I have right now, and the health insurance policy I'm going to buy will not only change the nature of the health insurance industry, it's going to change the way healthcare is delivered. The main thing that is going to happen, to go back to the 80-20, is if I were diabetic, or if I had AIDS, or if I had congestive heart failure, what I would be looking for is what's called a network. I would be looking for a team of people who would do everything I needed for my diabetes. And if you have diabetes, you need a lot done for you. Everything I needed for my AIDS, and the insurance company would say, come to us. We offer you an integrated network for everything you need for your chronic disease or your bad back. Let me give you an example of this from the consumer-driven industry. When I need another dark pantsuit to go with the 80 dark pantsuits that I have hanging in my closets, which are all differentiated by one characteristics, and that is they have long jackets for ladies with hips, I go to one store. I go to a store that is called professional or career dressing. What that means, it's code word for dark pantsuits with long jackets for ladies with hips. Now, in this store, I can find everything I want. I can find a necklace, I can find a scarf, I can find a sweater, I find my shoes, my bag, everything is in this store. I have diabetes. I need, if I had it, I need an ophthalmologist because I'm going blind. I need a cardiologist because my heart is failing. I need a nephrologist because my kidneys do not work. Glucose destroys the circulatory system. I need a neurologist because my nerves have died in the bottom of my feet. I need a dermatologist because I don't have the circulation. I have ulcers that will not heal. I need an exercise physiologist, I need a food nutritionist, and if I had diabetes, I would need a lot of mental health support to deal with this disease. I can buy something as trivial as a career dressing outfit, sometimes comes with a red blouse if I'm feeling jazzy. And I can buy that very readily, but if I'm a diabetic and I need the ophthalmologist, cardiologist, nephrologist, neurologist, dermatologist, exercise physiologist, food nutritionist, I have to separately go to each one of these people. Now, in a consumer-driven system, it is unquestionable that these networks will emerge to deal and provide integrated care for people with chronic diseases and disabilities. These integrated teams reduce costs because they provide better medical care. This will be a great innovation, and it will reduce the costs by improving the quality of health care. So you're poor. How do you buy health insurance? Well, Instead of being stuffed into Medicaid, which is a very degrading program because a lot of physicians will not see Medicaid patients because they're so poorly paid. In Switzerland, the poor get enough money so that they can go and buy health insurance like everybody else. Suppose you're really sick. Will any insurer want to give you health insurance? Yes, because the Swiss insurers have formed a reinsurance pool. So here's how it works. If I were a woman in Switzerland, in Zurich, I would pay the rate of a woman my age, middle 30s, and the insurer would have no knowledge of whether I'm sick or not. Now, sir, what is your name? Yeah. Bill. So let's say Bill got me and I'm very healthy. He would make a fortune. What is your name? Steve. Let's say Steve is a different insurer. He got me and I'm very sick. He would lose his shirt. Steve is going to do everything he can to avoid insuring me, except Bill and Steve have formed a reinsurance pool, and here's the deal. They take the profits that Bill has earned for no good reason other than he's a nice guy, but he didn't deserve this. He earned it only because he got a healthy person who was paying the average rate. They take those profits and they give it to Steve, which ensures that, number one, sick people pay average prices, and number two, the insurance companies are interested in insuring sick people. They have terrific consumer information in Switzerland. If you're lucky, you go to Switzerland in July, you will see on the front page of the newspapers an announcement about what the health insurance prices are. You won't see that in the United States. They have 87 private health insurers. Some of them are run by nuns up in the Alps. You know those are closely managed health insurance policies. So what is the end result of this? This is people buying their own health insurance. The Swiss spend 40% less than we do. They have universal coverage. They could spend 8% of their GDP on healthcare if they wanted to. They would just buy more high-deductible health insurance, but they don't want to. They want to spend 11% of their GDP. What about the quality of healthcare? Is it like the UK or Canada? To answer that question, you have to look at what happens to sick people. Now, you may think that the Swiss are running around in lederhosen, yodeling in the Alps, but some of you may remember Needle Park, which was a needle exchange program for drug addicts that was pioneered in Switzerland because the Swiss have very serious drug and alcohol abuse problems. However, they are healthier than we are. The key test is how well do they treat diabetics, people with cancer, people with congestive heart failure. They have marvelous health care and marvelous outcomes. So here is a system that is both better and cheaper, and the key is the consumer controls the health care purchase. That is the only thing that's different about Switzerland. So what would I buy? Well, I would buy a high deductible, likely if I'm out in the market, but I'm interested in something else. How many of you ate yogurt or oatmeal for breakfast? Okay. How many of you stopped smoking or don't smoke? How many of you go to the gym 3 times a week or more? How many of you don't abuse? No, never mind. Okay. So you do a lot to make yourselves healthy, right? And actually, the 75-year-old cohort today is much healthier than the 75-year-old cohort 20 years ago because people take a lot more action to make themselves healthy. Why don't you get rewarded for this? So here's a Swiss policy, 5-year policy. They measure your health in the beginning of the 5 years. They predict how healthy you'll be 5 years from now. You have to stay with them for 5 years because they're going to make you healthy. They're going to help you get healthy. And they want you to be around with them when you're finally healthy. Here's the deal. At the end of the 5 years, if you're as healthy as they predicted or healthier, they give you half your money back.